This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
It is Breast Cancer Awareness Month, and while millions of women face a breast cancer diagnosis, thanks to advances in treatment, the survival rate keeps increasing. Here to share how new cutting-edge technology is helping some patients, we welcome from Providence Cancer Institute, radiation oncologist and researcher, Dr. Christina Young. Good morning, Dr. Young. How are you this morning?
I'm great. Hi, how are you?
Good. So talk to me about the importance or the role that radiation plays in the lives of people who have just been newly diagnosed with breast cancer.
Yeah, radiation is one of the sort of standard pillars of treatment for women with breast cancer. I think regardless of surgical choice, a lot of women end up with needing some radiation afterwards as part of their local therapy to reduce the risk of local recurrence.
And Providence now has new cutting-edge technology when it comes to radiation, right?
Yeah, we're very excited. We are the first in the Pacific Northwest to acquire a new technology called an MR Linac, which combines the technology of an MRI with our standard linear accelerator. And this new technology really allows us to better visualize lumpectomy cavities or tumors elsewhere in the body and be able to target them with much more accuracy. And the technology allows us to actually see tumors in motion if there's movement with respiration or even with like bladder filling. And it allows us to adapt or change our plan each day based on changes in personal anatomy. So it allows us to deliver higher doses per treatment and fewer treatments overall, and really minimize some of the toxicity that we've seen with traditional radiation therapies.
When you say toxicity, what do you mean by that exactly? Like because I know when I had radiation, I know I felt the burning, so radiation had to stop for a little bit so I could get over that. Is that what you're kind of talking about?
Yeah, I think, in terms of breast cancer, yes. So skin changes from the treatment as you're going through it. So you can get some burning of the skin and some irritation there that can cause breaks in treatment and a lot of pain and discomfort for patients. And even more so sort of late complications. So sometimes you can get a lot of scar tissue buildup.
Oh, right.
Reconstruction. And so I think that this technology for breast cancer specifically is really aimed to minimize toxicity in women who have very early low risk breast cancer, for whom we have excellent survival outcomes. And now we really are trying to peel back the treatments and maintain those excellent outcomes, but diminish some of that toxicity, both short term and long term.
Wow.
And so this allows us to have a smaller target volume. So we really just target maybe a lumpectomy cavity and a little bit of tissue around it. The treatment, instead of being 3 weeks or 6 weeks, can really be done in 5 treatments.
Wow.
Yeah, so it really allows us to try to tailor the treatments more specifically for patients as they're going through.
That is fabulous news. Is this something that can be used on other cancers as well then?
Yeah, so we're really excited. Like I mentioned, this technology is really a game changer for us. So it's very unique. We're able to treat tumors all over the body that perhaps we wouldn't be able to treat previously, particularly intra-abdominal tumors. We've had a lot of success targeting those. We're able to visualize them better, and we're able to be safer in our treatments and avoid some things like small bowel and stomach that we maybe couldn't be as accurate with previously.
Are there any other advances you see coming your way?
Gosh, we're so excited here at the Providence Cancer Institute. We have so many clinical trial opportunities, and we're really a pioneer in the immuno-oncology space.
Yes,
and so,
yes.
One thing that we're looking forward to is being able to combine these two technologies with immunotherapy and this new MR Linac technology that allows us to give higher doses per fraction. We think those two things can complement each other really nicely. So we do have some plans for a clinical trial for women with breast cancer that will combine those two therapies, and we're hopeful that it will prevent recurrences for women with estrogen receptor positive breast cancer.
Yeah.
And it's an unmet clinical need in that population. So
This is just great news. That's amazing. Thank you so much. We'll tell folks, if you'd like to find out more, contact Providence Health Services, Providence Breast Services at 503-215-6014. We'll put that on KATU.com. Dr. Young, thank you so much.
Gosh, thank you so much for having us.
You bet. We'll be right back with more AM Northwest. Don't go away.